All right, everyone. Hopefully, everyone's been able to connect with us and join us this morning here in the Pacific Northwest. Again, my name is Will Bowden, and I'm a sales engineer for Interscan Corporation. And today, our webinar topic is going to be on toxic gas detection and health sterilization applications. Just a brief introduction to Interscan. Interscan provides easy to use, easy to own specialized gas detection instruments with emphasis on trace level toxic gases. So within health sterilization, we have specific challenges with three different gases that are used. First of all, we have ethylene oxide. Some of the disadvantages with using ETO are toxicity, health risk, which includes skin and eye irritation, dizziness, respiratory issues, and in situations of long-term exposure over a period of time can lead to causing cancer in some individuals. The environmental impact, it contributes to pollution, and it's also highly regulated. Regulatory challenges include the compliance requiring costly safety measures, which we'll get into detail in some situations in the past here soon. Next item on our list is hydrogen peroxide. In terms of hydrogen peroxide and its uses, we have residue concerns, may lead behind some residues on some equipment. And then the next item would be compatibility. We have limited suitability with certain materials. Exposure to hydrogen peroxide can degrade some materials over time. And thirdly, we have regulatory compliance. We require specialized equipment due to strict regulations with OSHA and EPA backgrounds here in the US. And finally, we have peracetic acid. With peracetic acid, one of the items that we have to think about is corrosiveness. It can corrode some materials over time, restricting its use. With odor and irritation, there's a strong odor and potential respiratory system, skin, and eye irritation issues. And finally, we have regulatory compliance items, which include rigorous monitoring and control measures for peracetic acid exposure. So we have a special guest today. His name is George Meade. George is the owner of MedBrokers, and George has very extensive background in healthcare sterilization and spent 30 plus years in the industry. And George, I'm going to let you take it away.
Very, very good, Will. Well, thanks for the opportunity to talk to everyone today. As Will said, I have a lot of field experience. I'm the owner and president of MedBrokers. We have 50 plus customers, ranging from hospital SPD departments to any type of industry you can think of: vet labs, dental labs, surgery center labs. All across the country. So, and we're actually global too. We do service some Asian and Canadian accounts as well. So I'd like to talk to you today about three specific, I could come up with many examples, but I came up with three case studies because we're limited on time here that just demonstrate how gas detection and the proper approach to gas detection can solve real life problems. So Will, if you want to go to the first case study. All right, there it is. Okay. So the first case study I chose is a very large supply chain company. And not that this isn't an issue for hospitals too, but any company that's based on logistics and supply chain, speed is imperative. So how do we make sure our employees are as safe as possible, but yet not slow down packages, right? Or not slow down the delivery of services. So a concern to everyone, especially so in this industry. So this particular company runs very large warehouses, and they had the issue where their employees were reluctant to work with products that were treated with EO. So they specialize in medical products. So nearly all of them, in vitro and in vivo products, are treated at the manufacturing site with EO. And so the concern was, as these products are being then shipped after a sufficient degassing time, as they're being shipped to the warehouse, is it safe for our employees then to open the trucks, to have the trucks approach the warehouse, and to unload those trucks? And so the company safety personnel, their insurance company, their external customers, and their employees all got together with Interscan and MedBrokers and decided to figure out the best way to do this without sacrificing efficiency. And it turned out that the missing part was having real-time results. So they were able to plug that hole by using Interscan portable EO monitors and a very strict SOP, again, that was shared with everyone. So that meant that if a manufacturer was not letting their product degas sufficiently, they understood that when that was delivered to this company, that truck may be refused. So it ensured compliance from everybody. And then the other very important thing about this was the fact that annually we would have employee education, and not only about how to use the meters properly, but also about EO and what EO is. We all know that, things that we don't understand, we can be afraid of. And there's a lot of apprehension, especially when there's signs telling you how deadly EO can be. There's great reluctance from the employees to want to work in EO departments, as you might imagine. So we found that the education and the competency audits were huge in overcoming that obstacle. And so the result of all of this was we have a safer warehouse environment, and this is a global corporation, so safer warehouses across the globe, less employee apprehension and reluctance to work with EO, and it does not affect their turnaround times. So it was a win-win situation where, gas detection filled in the missing link. So the second case study is an example of hydrogen peroxide. So the question or the problem is, and I'm sure all of you are dealing with now, is so OSHA doesn't require H2O2 or PAA sterilization to be monitored, right? There's no requirement. So why should I, or should I consider it? When about the time that plasma sterilization came out was right about the time when all the EO studies were coming out, explaining the health dangers of EO. So I don't think it was done intentionally, but there was a perception that, hey, this new plasma stuff is obviously safer than EO because I don't need to put up placards that say it causes cancer. So it must be safer, right? Well, in essence, ironically, it actually has H2O2 vapor at the concentrations necessary for plasma sterilization, has the same PEL, permissible exposure limit, as ETO. It's 1.0 ppm over 8 hours. And the other thing, if you look at the NIOSH reading, which is the IDLH, which stands for immediately dangerous to life and health, H2O2 is actually 10 times more dangerous. So ETO has to get to 800 ppm before it will kill you, whereas hydrogen peroxide approaching 75, less than 1/10, becomes extremely dangerous. So the question is then, okay, well, why should I go ahead and do this ahead of the regulations? If you think about it, we're kind of, with the plasma sterilization, we're kind of where we were with EO in the 80s, right? We sort of understood some of the dangers, but they weren't clearly documented, yet they weren't regulated. So not many hospitals decided to move forward with EO monitoring back in the day. So I have a particularly large hospital network in the Northeast that decided very quickly that they needed to have permanently mounted Interscan H2O2 monitors in their H2O2 sterilization laboratories, because unfortunately they had an incident where an employee was injured while removing a load from an H2O2 sterilizer. And it created a lot of panic, a lot of fear, a lot of angst. So just like with the previous company I talked about, the collaborative approach to gas detection is so huge because Interscan then and MedBrokers were able to work with the SPD folks, right? The industrial hygienists at the hospital network, And we were able to come up again with an SOP, so a plan of which gas detection is a major part, but you still have to have a plan that utilizes the advantages of interscan monitoring, that is real-time results because of active air exchange, and then alarms set at a point that will warn the SPD workers at their most vulnerable time. So the bottom line after all of this was that after this large health network decided to implement the interscan monitors for H2O2, there's been no more accidents or reported exposures involving H2O2 sterilization. And then as our third study, I thought this would be a little fun because this gives you an idea how the world of gas detection applications is huge, right? There's just so many. Again, I had a hard time picking only three. It's just used in so many ways that most of the public aren't even aware of. One is the problem of, okay, so we now have astronauts, or in today's world, it can be private citizens returning from space, right? Splashing down in the ocean. Well, that spacecraft can emit very toxic levels of hydrazine, right? So before those astronauts and the recovery and landing crew can get close to that, what NASA does is they send out a crew in a Gemini boat to go out to the spacecraft using interscan portable hydrazine monitors to make sure that the hydrazine levels are very low and it's safe to proceed with the recovery. So again, it's just the world of gas applications is just amazingly broad. And of course, this helps eliminate any type of exposure to hydrazine by the people then back on the big boat, right, that eventually do the recovery, and the astronauts themselves. So those are three of my field examples. And again, I know we're holding questions to the end, but if any of you would like to reach out to me directly, this is my contact information. Again, I've been working with Interscan, or I should say MedBrokers has been affiliated with Interscan since 1996. So we work very closely with them, and would be glad to help you with any of your gas detection needs. So with that being said, thanks for the opportunity, Will, and I will stand by throughout the rest of the webinar.
All right. Thank you very much, George. I appreciate it. And again, just as a quick reminder, we will have a question and answer session at the end, and George is going to stay on with us, and we'll be able to ask George anything. So, all right. So some of the examples that we have here. So we say risk associated with gases. And we have three examples here, and we're going to include links within the chat box to the stories on these. First of all, there's a company outside of Atlanta called Sterigenics, who just settled a $35 million civil settlement from 79 claimants due to long-term health exposures and then cancers that they attributed to exposure to long-term ethylene oxide releases out of this facility. This facility has been there for decades and surrounded by neighborhoods. And this was a situation that over time, many unique cancer clusters were found in the area and contributed to exposure to ETO from Sterigenics emissions. Next item is a sterilized medical device off-gas exposure in warehouses. And again, we're going to include a link to that story there. In particular, third example would be a 54-pound ethylene oxide release over 8 days at a BG sterilization facility in Conyers, Georgia, which is also outside of Atlanta. In terms of the regulatory fines, that's still to be determined. There's still some litigation and some court cases going along the way with that. However, very recently, there have been a similar situation to Sterigenics in that people living around the facility are starting to put together civil lawsuits against BD and possible exposure to ethylene oxide over time. So the first gas we'll discuss in our webinar today is going to be hydrogen peroxide. So hydrogen peroxide has a permissible exposure limit of 1 ppm over 8 hours and immediate danger to life and health at 75 ppm, as George discussed previously. The hydrogen peroxide breaks down into water and oxygen, leaving no harmful residues, making it safer for both patients and healthcare workers compared to ethylene oxide, which has been found to be carcinogenic over long-term exposure period of time. Hydrogen peroxide can be used as a sterilizing agent for medical devices and equipment, particularly those sensitive to heat and moisture. And there's also, and materials that are also prone to corrosion from ethylene oxide exposure. Which leads us to the discussion of ethylene oxide. Ethylene oxide, a permissible exposure limit, has a 1 ppm over 8-hour period of time and immediate danger to life and health of 800 ppm, as George previously discussed. Ethylene oxide is commonly used to sterilize medical devices and equipment that are sensitive to heat and moisture, similar to hydrogen peroxide and in items such as surgical instruments, catheters, and syringes. It can also be used for sterilization of surgical dressings, gowns, gloves, and linens, helping to prevent the spread of infection due to skin exposure. However, brief contact with ethylene oxide can cause respiratory discomfort, headaches, nausea, vomiting, diarrhea, breathing difficulties, and discoloration of the skin. And studies have proven long-term exposure has been linked to cancer, as we previously discussed in some of our situations previously with the health sterilization facilities and their emissions over a period of time. So, but other items and other issues that can come up over that time are respiratory, reproductive issues, genetic alterations, nervous system damage, and heightened sensitivity to exposure to other environmental factors. And finally, we're going to focus on peracetic acid. In terms of a permissible emission or exposure limit, there's no set limit at the time. The jury's still out on that. There's still some discussions going on as to a permissible exposure limit. Immediate danger to life and health is 0.5 ppm is a proposed limit that is currently being reviewed by OSHA, NIOSH, EPA, et cetera. Peracetic acid is widely used for health sterilization due to its strong antimicrobial properties and effectiveness against broad spectrum microorganisms. PAA sterilization typically requires shorter exposure times compared to the other sterilization methods mentioned, allowing for faster turnaround of sterilized items. Acute exposure to peracetic acid can be irritating to eyes, respiratory tract, and skin. PAA is a strong sensory irritant considered to be more potent than acetic acid or hydrogen peroxide, yet is a safer alternative to other methods. The next time here, we do briefly discuss OSHA environmental regulations, and we're going to provide a link as well to the to OSHA website that goes into specific chemical exposure limits, and then also EPA parameters in terms of specific chemicals as well. So under OSHA regulations, specific immediate danger to life and health and permissible exposure limits are set for toxic gases that are present in health sterilization applications. And OSHA regulations also cover exposure events and accidents and parameters along the way. As we mentioned previously, the EPA is also involved, but EPA is the federal level, and then state and local environmental protection organizations have their own regulations. Uses exposure guidelines from NIOSH and OSHA guidelines for health and safety of workers, and states such as California here in the United States may have stricter guidelines than federal. And then again, EPA guidelines regulations for emissions, especially for greenhouse gases, methane, carbon dioxide, et cetera. Obviously, studies are going on over time with other gases that could be considered greenhouse gas affiliated or related issues. So the big question that we have today is, what does a medical facility do to prevent exposures, injuries, and fines? Every toxic gas present in a medical sterilization facility is detectable. There are two platform options available for these scenarios from Interscan. Our first is our portable gas detection monitor, our Gas D8000 series. And our second is our AccuSafe product line for fixed gas detection. So we'll start out with a little bit of a story about our Gas D8000 portable gas detector. As you can see here, this is our portable unit. It has an integral sample pump powered by rechargeable lithium-ion batteries, giving up to 8 hours of continuous service. As you can see on the screen, that's a digital readout of concentration, along with real-time graphics display and integral data logging. Also built in is an audible and visual alarm. On the back side of the instrument itself, there's actually a terminal strip that you connect to the analog output for 4 to 20 milliamp and 0 to 2.5 volts. This gives the ability for an additional external alarm, lights, strobes, etc. And the next item that we have here is our AccuSafe fixed gas detector. It's one control unit for up to 10 sensor units, sensor modules located in remote locations. So the control unit, as you can see on the bottom, has a display. This can be mounted outside of a sterilization area outside the door, can be interrogated remotely via web browser, desktop app, and then API. It includes 8 gig of data storage. Data acquisition is built right into the control module itself. And the communication is via Modbus TCP and RTU, which is actually RS485. And it includes sound and email alarms. These settings can be set up to send an email alert to contact set up in their system to let them know that there's an alarm happening and someone needs to go and evaluate the situation. So in terms of alarm set points and measurement range criteria, a lot of organizations go by OSHA or NIOSH guidelines in terms of setting their criteria for what they want their alarm set points to be. Others may have an internal environmental health and safety criteria that they use. It's really going to be dependent on a case-by-case basis. A lot of times internal standards may possibly be a lot stricter than what OSHA standards are, just to be on the safe side and be a little more conservative and being able to detect any possible exposure events, being able to protect employees. So one of the parameters that we look at there is risk assessment. So evaluating the potential exposure scenarios and associated health risk for each gas. The next item, as we mentioned previously, regulatory compliance, understanding permissible exposure limits set by regulations to determine detection range requirements. Again, those can be guidelines for some. Others may be a little more strict than that, just to add a little more of a conservative buffer. And then equipment specifications, being able to select detection devices capable of measuring concentrations within the anticipated exposure range that is set. And then finally, in terms of safety protocols, being able to establish protocols for early detection of gas leaks and prompt corrective actions to ensure worker safety. For example, maybe an initial alarm could be just a caution, and then a higher level alarm could be set in place for this is a full-blown leak and immediate extreme corrective action is mandated. So the question we get from many people is, what does it look like to set up a gas detection system? First question that we have is, do we want to go with a portable unit? Do we want to go with a fixed system? What does that look like? So in each situation, we like to discuss and review application details and requirements. For example, any internal set requirements for alarm set points. Is this going to be a portable unit? Or are we going to be using this in multiple areas that maybe aren't close enough to be able to be connected via the AccuSafe system, the fixed system, where a portable unit may come into play? For example, maybe actually an outside storage facility for all their gases. Each individual application is different. That's why we like to discuss those and be able to customize and correctly provide a system solution that's going to fit the requirements for the customer. So it goes into providing the correct detection solutions that meet the needs and demands of the measurement application itself. Other factors include environmental factors, temperature, humidity, etc. The next item on the list is being able to provide operation and maintenance training and support on our instruments. We have a great customer care team that's able to provide technical assistance in situations that may arise in the field. You're able to reach out to them anytime. We'll be able to analyze the situation and be able to walk through solutions in the field. We're also able to provide live support as need be, depending on the extremity of the situation. Another item that we have, as we mentioned previously, is both the Gas D8000 and the AccuSafe both provide internal data. Gas D8000 has a 32 gig SD card slot to be able to log all the data, be able to pull that out and interrogate that on your computer, be able to take a look at the data, analyze that in spreadsheet format. AccuSafe, as you mentioned previously, has 8 gig built in. It can also be interrogated remotely via a web app from your desktop or laptop. Another item that we have, another program we have, is Sensor Express. In Sensor Express, this eliminates the need to be able to have the ability to be able to calibrate sensors on site. Sensor Express program basically provides a new calibrated sensor every 3 months that's ready to go. You receive it, you're able to plug it right in, and you're good to go. This eliminates the need to have additional capabilities for having calibration gases or send sensors back to us to have those calibrated, which would obviously take the sensor out of the instrument themselves and be able to not have that exposure over time. So it's definitely a great program for those facilities that don't want to have to deal with cal gases and going out to gas suppliers, and then having someone that has the knowledge to be able to calibrate those sensors internally. Which actually leads us to the final item that we have here is quick replacement sensor module. As you can see in the photo, if you see the black housing up on the top, the white module on the right-hand side of that housing is actually the sensor module itself. It's mounted externally, makes it easy to get to. You're not having to open up the case to go in to replace the sensor. The sensor module itself simply unplugs, and then you can take the new sensor module and plug it right in, and you're ready to go. All right, so that concludes the presentation portion of our webinar. So we definitely would like to extend a Q&A session here. George and I both are here, and so let's see here. Let me get this pulled up. So the first question that we have here is, what kind of support and training comes with the gas detectors? All right. So it's like I have my assistant Susie Truitt is going to answer this question.
I'll defer to you, Will.
No worries, no worries. So again, as I mentioned previously, we have live technical support here in our facility. We have our technical support team that is able to provide initial troubleshooting activities, be able to give basic responses at first. Obviously, if we have situations where we need a little more in-depth discussion, we're able to provide live calls via Teams or Zoom, where we can evaluate the situation and be able to provide additional support, additional troubleshooting, and move forward to the next step if there's a situation that maybe we need to bring the instrument back in for evaluation and move from there. In some situations, depending on the extremity of the situation, and if they're unable to send the instrument back in to us, we can look at other options as well, possibly on site if need be.
Yeah, I'd like to kick in a little bit too.
Go right ahead.
To talk about the training part as well, Will. So I have many customers where we train, and from, I think it was my first case study, it really is critical, the training and the competency audits, both for you to be able to keep up with your regulatory agencies, especially during inspections, and also for the morale even of your folks that work either in SPD or work in industry with some of the gases that Will talked about today. Oftentimes what we do is we have some customers that I visit every 3 months to do calibrations, and we actually do training every 3 months because of high turnover. I have other customers, like the customer in case study 1, where we do training either remotely, because remember, they're global. So we either do remote training, which tends to work really well, or live on-site training every year, and then go through a competency and go through an approved education slide deck as well. So that's also offered as well with the products. And of course, to answer this question, it really depends on what you're buying, right? So, if you're buying a portable like the Gas D8000, the installation requirements and the training requirements are a lot different than if you would buy a full-blown AccuSafe solution with maybe 5 gases and 7 different sensor points. So that plays into it as well.
No, excellent. No, thanks, George. Definitely a lot of things to take into consideration here. And so one of the next questions we have here is, what are common issues faced with gas detection systems and how can they be resolved? And I'll start out as a general gas detection applications, and George, please feel free to chime in terms of the sterilization specific issues that you've seen in the field. In terms of common issues faced with gas detection systems, a lot of times it can be environmental. For example, if there's other mist or vapors or other things that are in the air, temperature, humidity, there's other items that come into play in terms of gas detection applications overall that can cause possible issues. We do, for example, we have an application that we're working with an extremely harsh environment that has other vapors and mists that are in the air, and being able to work with them to come up with some solutions in terms of filtration issues, that we're filtering out the other vapors and mist, but we're still making the proper measurements for the particular gas that we have.
Yeah, and Will, that's basically the same issue that we have in SPD as well. And again, I hate to keep beating the drum here, but that's why it's so important to have people that are trained properly so that if an alarm does go off, they know how to react and they know the questions to ask themselves, because the most common interfering vapor, of course, is alcohol. So if there was cleaning done, if there was vapor done, I just had a customer in North Carolina where they do their monthly generator test, and they had to lubricate the generator, and the generator shared the wall with the ETO room, and it was a solvent-based lubricant, and that got into the ETO room, and of course was picked up by the monitor, and so it went off in the middle of the night. And because this is a customer where we do training, they realized, hey, we're not running ETO. There must be something else going on. They contacted facilities, and they found out that work was done, and it set off. That's what caused the monitor to go off. So, and just a note about that, used to be a bigger problem with the legacy gas sensors, the newer cartridge-based sensors now, although they still have interfering substances, they're much less vulnerable to alcohols and ketones as the previous generation sensors were.
No, absolutely. And that's the key in the initial application discussion that we have with each customer, is we need to be aware of any other constituents, other chemicals, vapors, et cetera, that are in the environment, because depending on the measurement that we're looking at, there can be other cross interferences. And as George mentioned, these can always affect the measurement in one form or another. And that's why it's important for us to have that initial conversation up front, so we understand the environment in which we're working in, so we can properly configure, the optimal solution that's going to work within that environment and to minimize the issues down the road.
Yeah, and just one last quote. The person asking the question might be wondering why Will and I are just talking about interfering gases and training and things like that. And it's because these monitors really are extremely reliable. I can tell you that I have monitors in the field that were installed in the early 90s they're still working well. They're just built to last. They're very solid electronically and mechanically. So there's not a lot that goes wrong with them from that standpoint.
No, absolutely. Yeah, and we have other applications that we work with Interscan that have been in play, as you mentioned, since the 90s. Some I've seen some come back that have been, way back even into the 80s, that are still working. So, it just goes to support, the quality of the Interscan product over time. Next item here is, what is the battery life of one of these instruments? Well, the Gas D8000, our portable instrument, has a rechargeable battery in there, and that's it. The standard time with that is roughly an 8-hour period. In terms of the battery life itself over time, in terms of how long that battery is going to last with recharging over time, don't have that right off the top of my head, but I can get the answer to that specific question, and we can provide the answer to it.
Yeah, and that's a lithium battery, correct, Will? The previous generation NiCad, going back to the previous generation portable Interscan portable monitors, again, would last decades. So, I would expect these to be just as rugged, if not better.
Absolutely. So the next question we have here is, how many rooms or areas can be detected with one fixed system, and can you detect different gases with one system? So the sweet spot is due to the size of the display and being able to have the file holder tabs for each sensor module. The sweet spot is 10. Since we're communicating with RS-485, we can go up to 256 points, but then the actual display face becomes cluttered over time. So we say the sweet spot is 10 different modules. Each module can detect a separate gas. So for example, if you have let's just say, for example, you had ethylene oxide and hydrogen peroxide in one room, you would have two different sensor modules for those. So you'd have one for the ETO, one for the peroxide. And so that's two modules right there in that room. If you have another room that has the same configuration, that'd be two more modules in that room. So to answer your question, each module is set up for an individual specific gas and a range. So if you want to do different gases, you can do that. So the next question here is, how often do sensors need to be replaced? And the answer to that question is really, it depends. We recommend, obviously, with our Sensor Express program, we provide, like I said, a new calibrated sensor every 3 months that can come into play there if that's going to be a requirement on the end, especially if there's some regulatory parameters or maybe corporate standards by which they say that, you know, we want to make sure that these are calibrated every 3 months, 6 months, or whatever. However, depending on the application, depending on the gas, depending on exposure over time, we can go 6 months, a year with sensor replacements. It really depends. Now, what I will always say is, if you have an event where you had a leak, an accident, et cetera, where the sensor was exposed to extremely high levels of a particular gas, chances are I would definitely recommend replacing that sensor, just because when a sensor is hit with a slug of gas like that, that can affect the life and performance of that and degrade that very quickly. So in situations like that, I always recommend be on the safe side, go ahead and replace the sensor if you've had an incident in that situation. But in terms of day-to-day exposure and activities, 6 months to a year, like I said, again, depending on daily exposure, you know, we're comfortable going up to that point. And George, feel free to chime in, and I know you've seen probably seen many other customers there out in the field. So.
No, that's, and it depends on, is it continually used? Is it a portable where it's not used nearly as much? So there's a lot of variables that go into it. But, good practice is 3 months, 6 months in some lower use applications. The other just quick note too, about, you were talking a little bit about the AccuSafe. The really nice thing, to the person that asked that question, the really nice thing about that system is, do you know what gases you're going to be monitoring in 10 years or even in 5 years? The things are in such a state of flux right now. It's a really customizable, scalable system, so that you can start off, okay, I want to start off with ethylene oxide, okay, but I'm moving now more into H2O2 and PAA. You can easily then just add the particular module right into that AccuSafe network very economically and very easily. And the other nice advantage that Interscan has over a lot of its competitors is the data logging and the analytics that are built in. So you don't need a separate program, you don't need separate software. It's all built in to be able to manage all those separate sensors, combine graphs, do really anything. The amount of intricacy and flexibility of data analytics in these analyzers is really mind-blowing. So it's a nice strength of that product.
Indeed. And George, as you mentioned, we don't know what new technologies and chemistry is going to be used in the future. Everybody's looking to improve on what currently exists. So, who knows what we'll see in the next 5 years, 10 years, maybe even, a year or two that we'll see out there. So, with that, we have the ability, we have a great engineering team that we work with, that we're always taking a look at new applications and willing to evaluate new technologies along the way. So we got a quick question here. So, can I wirelessly view data from the instrument via Bluetooth or Wi-Fi? On the portable instrument, we do not have Bluetooth or Wi-Fi capability in that. On the AccuSafe, it's not built in. However, because we do communicate via RS-485, if you want to take the output from the AccuSafe instrument itself, you could take that to a Bluetooth module or a Wi-Fi module, and then monitor that wirelessly via that format. Obviously, that's a case-by-case basis, and we can have a discussion on that and the feasibility and what we would need to have hardware-wise to make that happen. All right. Well, it looks like we've answered all our questions that we have here. A link to the recording of this webinar is going to be sent to everyone, along with the slide deck that we have here. And please feel free to reach out to myself or George. George's contact information was presented previously. My contact information is presented here on the last slide. And if you have any questions, please feel free to reach out to both of us anytime. And we partner together on many applications, and we don't mind meeting with you as a group. So again, thank you everyone for your time. We greatly appreciate the consideration of Interscan, and we look forward to working with you soon.
Thanks, everyone. Appreciate your time.
All right, thanks a lot. Have a good day, everyone.